Good night, everybody. We are 7 at this point. We must be 19. Let's wait 3 minutes and then we can start, okay? I think 3 minutes is going to be enough. Okay, good night, everybody. Let's start. Let me share a screen and please let me know if you can watch my slides, okay?
It's okay.
Okay, everybody, thanks for being on time. Here we have a schedule to follow. It's 8 and 4, I think. But well, let's go ahead. As I was telling you yesterday during the workshop, today we have a long class. I mean long because we have lots of slides, but according to the program, to the schedule we follow, there are a lot of slides for self-studying. So let's start, okay? First of all, we must consider this detail. the introduction to medical terminology. We use this introduction in this second presentation because the previous one is too basic. I mean, it's just a general view, a general overview for all anatomical landmarks and systems, and a few expressions that are very common. And central ideas, I mean, main ideas like illness, sickness, and disease that we were talking about. And well, now it's time to understand how medical terms are done. From this point, you have the chance to realize, we can say, how a medical term is built, is done. In that way, we have the word root, the combining form, I mean the vowel that is added for combining the word root, the suffix, and the prefix. These four terms are helping us to understand that it's possible to infer the meaning of a medical term. The word root contains the basic meaning of the term. For example, gaster. Gaster is coming in Latin, but we know that the meaning is stomach, of course. When we might want to make this word root into medical term, we add a vowel. That is the combining form. Usually the vowel is added at the end. For example, an O, gastro. And we know that this word is referred to the stomach. The suffix, usually but not always, indicates the procedure, condition, disorder, or disease. We are going to see some examples in some slides ahead, okay? The prefix, usually but not always, indicates location, time, number, or status. Following this, it's easier for us to deduct the meaning, to catch the meaning. Checking some details, specific details about the word root, we must consider this. A word root cannot stand alone. You always need a suffix. It has to be added at the end of the word to complete the term. If a word root is without a vowel, it is without the combining form, it's not possible to catch the meaning, catch what we are talking about, I mean. The rules for creating a combining form by adding vowel apply when a suffix begins with a consonant is added to a word root. We are going to check some examples ahead. When a prefix is added, it always plays at the beginning of the word, of course, the same as in Spanish. That's why prefix and suffix, we understand meanings. Some examples about word roots are these ones that indicates color. For example, cyan means blue. The best example, cyanosis, right? Eryth or erythro, the O is the vowel, the combining form. It means red, erythrocyte, red blood cell, right? Leuc or leuco means white, the leukocyte. Melan or melano means black, melanosis. So you can see the suffixes, how they are added. Poly or polio means gray, poliomyelitis. So you can see we have the word root, the combining form, and a suffix that is giving us the sense of the medical term. The most common suffixes that we use in almost all the medical terms are these ones in these charts. Suffixes as noun endings. We have these 5 ones: a, e, as, and y. For example, crani means school, cranium, we built cranium, right? Suffixes meaning abnormal condition. We have 7: ago, isis, aya, iasis, ion, ism, osis. Talking about gastro, but the stomach, gastrosis, right? You can see on this example. Suffixes meaning pertaining to. We have this, then 12 ones, right? Oh, 14 ones, I'm sorry. All of them are showing us that this structure of the word root pertains to a specific organ. I mean, cardi is the word root, the heart, plus AC, cardiac. The term or the situation we are going to describe belongs to the heart, belongs to the cardiac, to the heart, okay, to the cavity. More suffixes. They are related to pathology. It's the same as in Spanish. As you can see, there are some letters that are changing because that's the difference in languages, but the meaning is the same. Algia, pain and suffering, for gastralgia, for example. Dynia, just pain, for gastrodynia. Iris, the inflammation, for gastritis. Megaly, the enlargement, hepatomegaly. Malacia, abnormal softening, arteriomalacia. Necrosis, tissue death, arterionecrosis. Sclerosis, abnormal hardening, arteriosclerosis. Stenosis, abnormal narrowing, arteriostenosis. Right? Easy to check, very common ones. The same as in Spanish, as I was telling you. And you can see an example, like an scramble. Tonsil, the tonsils, of course, plus iris. We have tonsillitis, inflammation of the tonsils. Easy examples to catch the idea, right? Suffixes related to procedures. Again, they are the same as in Spanish, just with small details in grammar, but the meaning, of course, is the same. Synthesis, the surgical puncture to remove fluids for diagnostic purpose or to remove excess fluid. We all know about it. Amniocentesis, arthrocentesis, okay, plurosynthesis. Graphy, process of producing a picture or record, angiography. Gram, picture or record, angiogram. Plasty, surgical repair, myoplasty. Scopy, the visual examination, arthroscopy, okay, or endoscopy too, right? Easy to catch. We have these double R suffixes. It's a grammar rule. Always you use them. They must start with double R. For example, Raj and Raja. That's bleeding, a sudden severe bleeding. Hemorrhage, hemorrhagia. The Rafi, surgical or suturing close a wound to use of sutures, staples, or surgical glue. Myography. Rhea, flow or discharge of most body fluids. Diarrhea. Rhexis, the rupture. Myorrhexis. You know about it. You know that that's the way we talk about, right? So, same meaning as in Spanish, just the grammar rule, how we must write it down. Double R, H, and then the vowel, okay? Talking about prefixes, of course, they are added at the beginning of the word to influence the meaning of the term, right? For example, we have the prenatal, time and events before birth, the perinatal, and the postnatal. We all know about these meanings. The prefix pre, the word root not, and al as a suffix prenatal. Prenatal, the new medical term that is constructed, okay? About prefixes describing direction, quantity, size, and amount, we have all of them. 12 ones that are the most common in order to catch what we are talking about. For example, up, away from, negative or absent. For example, abnormal, out of normal condition, right? Add means toward, to, in the direction of, right? Another example, easy, macro, large, abnormal size or long, right? Micro, small, of course. Check all of this information. It's the same as in Spanish. That's why it's easy to catch the meaning. For example, dextro, the right side, sinistro, the left side. It's in English. Looks like Latin, but no, it's in English. About contrasting prefixes, we have the ab, for example, the abnormal means away from, and the ad means toward or in direction of. I mean, they are the opposite one to each other. This means bad, difficult, or painful, versus you means good, normal, well, or easy. Hyper and hypo, easy to catch. Inter and intra, sub and super and supra. Please read all of this information. Check the vocabulary we are catching on these slides because it's important to get this way of expressions. A grammar tip, very important grammar tip that I think we always don't take in count as a general rule when Latins learn how to speak in English, the medical terms. This slide is showing us how to exchange unusual plural forms. We always think in the same way that in Spanish, that we adjust at an S, and that's the way that the plural form is done. But of course, it's not the same situation, we can say. For example, we have these rules that are showing us the ending of the medical term in singular and how to exchange this medical term into plural without making a mistake, of course. For example, if the singular term ends in the suffix a, the plural is usually formed by changing the ending to ae. For example, bursa, bursa. The pronunciation is the same. The writing down way is the difference. Vertebra to vertebra, right? Another one. If the singular term ends in the suffix x or x, the plural is usually formed by changing these endings to ices. For example, appendix, appendices, index, indices, right? Some books might translate it as British and American English, but no, it's the singular and plural, right? So take it in count. While reading, while writing down, maybe we might find these plural ways. They are not a mistake, they're just changing. Another example from the end. If the singular term ends in the suffix -ium, the plural usually is formed by changing the ending to an A. Diverticulum, diverticula. Ovum, ova. Okay. Check these slides, read all of these rules, because following these rules, we have the chance to write down properly. Of course, again, as I was telling you yesterday during the workshop, to the ones who attended, I have some exercises when we write down paragraphs. We write down the case report, medical notes, and of course, we have the chance to apply, to use these grammar rules. So consider them, please study all of this. Tomorrow during the workshop, we can solve doubts about this grammar introduction in order to work properly. As I was telling you, well, this is just an introduction, the most general ideas, the most important in my opinion. And now let's go to the topics that we must study today. Our content is signs and symptoms, a very general view of this, the general signs and symptoms for almost all the diseases we must consider, all the topics we have to check. And we start with systems, bones, joints, and muscles. Talking about signs and symptoms, we must consider this. These terms are used for describing problems, describing how a patient comes to us and tell us what is going on, right? Symptoms are all the problems which a patient reports to the doctor. They are also called complaints, usually are called complaints. Symptoms when talked between colleagues, and complaints when you talk to your patients. Signs are what the doctor finds, also called findings. Complaints and findings. Findings is the easiest way to remind this. We have this doctor, a great good one with all the biosecurity, and he says, Mr. Gomez was admitted complaining of chest pain, and he started making his notes. We always use abbreviations. Why abbreviations? Because it's a general way to get in touch with our colleagues. It's a uniform way to share information and to write down fast. It's easy. The abbreviation about complaining of, C/O. Okay, we're going to use this one a lot. The abbreviation said, admitted, complain of, chest pain. That's enough. You don't need more details about it. Details have a specific space to be written down. When we start the contact with our patient, we got a presentation, of course. And patient says, they went to see the doctor. The doctor could say, the patient presented. As you can see, when the patient is talking, for example, to a relative about someone who went to the doctor, it's talking in past. The doctor, again, is talking in past. When you are with your patients, you are not writing down at the moment the patient is talking. You listen to him, you take enough time to hear what the complaints are at the moment, the cause of this appointment. And when you finish your speech, your anamnesis, then you start writing down. You start preparing your findings, your case report, your physical exam. Well, everything we know we have to do by a process. But the writing down time is at the end of the consultation, we can say. That's why we write down in English in past time, not in present, never in present. You might talk in present if you are at the moment with the patient next to you and you are taking notes while the patient is talking, but it's not proper, it's not correct. We all know about it. Talking about presenting symptoms, the symptom which cause of patients to visit a doctor, I mean the main symptom, the presenting complaint, the main complaint, all of these ways are how to express the principal situation why the patient is going to visit the doctor. We can say his presenting symptom was chest pain, right? We can say in another way, he presented to the GP with chest pain. GP, general practitioner. He presented to the general practitioner with chest pain. Again, in past. When we are talking about pathology or in a specific case, we are showing the situation to our colleagues. The usual presentation is chest pain because we are supporting some medical information related to this case. But as you can see, when we talk specifically about the patient, we are talking in past, always in past tense. Sometimes, well, not sometimes, always, talking in Spanish, we have the chance to make our notes, our medical notes, using the terms of the patient. I mean, the expressions that patients say. In Spanish, it's a general rule all over in Latin America. I could notice while studying and now while talking to some colleagues during these courses. When you have the chance to write down how the patient is explaining the situation, using the specific terms, the popular way, the common way to talk, that's correct in Spanish. In English, you don't have the chance. Why not? In English, you receive the information from the patient. You catch the meaning of this idea that the patient is talking about, and according to the situation, you write down the best symptom into medical term. We must, we can say that we translate the expression of the patient into the medical term. Why we do that? Because we must write down in a uniform way, without mixing ideas, without giving the step, or without giving the possibility for misunderstood ideas or lots of interpretations. That's why we choose a specific symptom and we translate the patient idea. For example, a patient could say, I feel tired all the time. The meaning of feel tired, loss of energy. Of course, tiredness, right? Another example. I've been feeling off color for 2 days. Feeling off color means general feeling or being unwell. It means malaise. The same as out of sorts, feeling of being unwell, malaise. While writing down the case report, we just said malaise. For example, my appetite is very poor, right? Very poor. Poor appetite, of course, is the loss of appetite. It's anorexia into medical term. Another one. I've been off my food for days. I've lost of appetite. It's anorexia again. My emotions are very hard. Motions are hard and infrequent feces. It's constipation. I've been quite constipated lately, or I'm not very regular. Here, all referring about constipation. So taking in account these differences from the expression of the patient to the symptom that he is talking about at the moment. As you can see, here's the red guy, and there is a list of symptoms. It's for homework. Of course, we don't have enough time to read all of this and translate into the patient expressions, the most common expressions, right? Read all of them, catch your doubts about meaning or expressions to change ideas, to exchange from patient expression to medical term, and tomorrow during the workshop, we can solve all the doubts about it. Okay, check this. All of this, the most common ones. Of course, they are repeated, some of them, but it's not important. You have the information to check these general symptoms. Okay, talking about bones, well, we all know that this is a very important system. We always study it at the beginning of every anatomical course. But during these classes, we are going to see this chart when we start a new system. We are going to see the overview of structures, combining forms and functions, in this case of a skeletal system. We have the major structure, bones, the related combining forms. We can find it like os or osi, os or osi, oste, osteo, ost, osto, right? 4 ways to combine this. And the primary function that we all know about it, but we can read it at home for catching some vocabulary. Again, the major structure, the bone marrow, the related combining form, miel or mielo, that also means spinal cord, right? The cartilage, we have the word root, this one, and the combining form, the O, condor and chondro, right? Joints, arthro and arthro. Ligaments, ligament or ligamento. Synovial membrane, synovi or synovio, synov or synovo. Synovial fluid, synovio, synovo, same, right? Bursa, burs or burso. You can see grammar rules for writing down properly and catching the meaning faster and easily. Here we have the combining the word parts, of course, with the meanings. Very important because with this information, we have the meaning of specific medical terms. For example, ankle or ankylo, cracked, bent, stiff. Some synonyms to catch the meaning of this word root. Arthro or arthro joint, chondri or chondro cartilage, again, cost, costo, rib, crani or cranio, skull. When you have a hyphen and then some suffix, of course, you can see it's suffix. This is to bend, tie together. This is a word root, kif or kifo, to bend or hump. Lord, lordo, curb, sway back, bend. Again, a suffix, lysis. Loosening of or setting free. Miel or mielo, spinal cord, bone marrow, we check this. Osi, osto, osteo, bone, of course. Scoli, scolio, curved, vent. Spondyle, spondylo, vertebra, vertebral column, backbone. Some synonyms to check the meaning. Synovi, synovio, synovo, synovial membrane, synovial fluid. And again, the suffix "-um", singular noun ending, as we were checking at the beginning. Check these word parts, easy to catch the meaning with them. This slide is showing us the bone tissues, just an anatomical review. It's for information. Check this, catch the specific words that are in the anatomical landmarks. Of course, we can ask for this. You have the information. Now it's your duty to check this, to practice, to memorize, maybe if you really need this. And how the specific words are done. Of course, we have these structures, the periosteum, compact bone, cortical bone, the spongy bone, cancellous bone, medullary cavity, medullary, endosteum, the bone marrow with red bone marrow, hematopoietic, yellow bone marrow, the cartilage, articular cartilage, and meniscus, right? Check this, read all of this. The same, of course. Well, we have our guy again. Oh, I'm sorry. This skeletal is showing us all the big structures with the most common names, all of them in English. We have, for example, this patella in medical term, and in parentheses, the common English term. Study this, check this, because of course, this guy is going to be into the homework and then in the final test. If you have just one like this, without parentheses, is the medical term and is the common term. But if you have both of them, femur and tight, you have the medical term and the common term. Check this, memorize this. Any question, I'm here to answer you any detail. By WhatsApp, we can get in contact and get some details that could be in practice. So you can see forearm, Very common expression, right? But in medical term, ulnar radius. So take it in count. Practice, please. Practice is very important. Talking about common names, the most common ones, the easiest ones to use, we could say skull for cranium, jawbone to mandible, spine to the vertebral column, breastbone to the sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, patella, shin bone, tibia. Take it in count, okay? Practice on them. And you have some more into the previous slide with the complete skeleton. I'm sorry, I closed my microphone. Talking about fractures, just a general view as a general, one of the most common and important pathologies, we could say. Of course, is the break in a bone. We all know about it. The pathological fracture is a fracture in a diseased bone. We all know this meaning, right? A good example of this is a fatigue or a stress fracture that is due to repeated minor trauma, for example, long distance marching or running. And the typical bone fractures are from this picture: the green stick, spiral, comminuted, transverse, compound, and compression, right? The most common ones, the most common classification of this. When you receive your patients, they must give you the common term following the common name of the bone. For example, the thigh fracture, forearm fracture, rib and clavicle fracture, the toe fracture, the leg fracture, spine fracture, skull fracture, and finger fracture. You can see that's the way the patient comes. And I have a finger fracture, and then they show you the structure of the problem, and then while writing down, of course, you go to medical terms. We all know about it. Some x-rays to check, just for practicing, for showing you the green stick fracture and how it looks, the cortical break, the buckle, and then we have the radius and the wound, right? We have the chalk stick fracture, very common in old people, in elderlies. The compression fracture, you can see how it works, how it is done, how you could see into the X-ray. The stress fracture, you could see it, right? Here is the fracture, here is I forgot the name, and it's here. The buckle, you can see the buckle here. You get the same buckle here. The same buckle, and here in the middle, the fracture, the stress fracture. About the healing bone process, it's just for information, because here you can check, you can read some expressions, some words that are related to this process, we could say. And according to this process, it's just for catching vocabulary, not for evaluation. Don't worry about it. Here we have the description of the healing bone process, the secondary bone healing. So take it in count just for reading and catching specific terms and ways to write it down. Okay. An example how the healing bone process occurs in a baby, in a newborn, how it works, how it happens. That's okay. Okay, and let's talk about treatment of fractures. Always when we talk about some treatments, pathologies, details like that, we are going to see words like this in capital letters and blackened. I mean, that's the vocabulary we must practice and try to memorize in order to improve our medical English. The treatment of fractures. When the fragments of a broken bone heal and join together, they unite. The union may be promoted or helped by reducing the fracture. I mean, replacing the fragments in their anatomical position if they are displaced. Right? You can see many ways to reduce this. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example, a splint, or a plate and screws. This is the plate and screws. This is a cast. We are going to see examples from splints. A displaced fracture which is not reduced may result in malunion, incomplete or incorrect union. This is the malunion, known in the anatomical position, and the non-union as complications from the malunion, from the non-correct fixation or non-correct reduction of the bone fracture, okay? Now I have this chart again just for information, for catching vocabulary, when we see the difference between a cast and a splint. A cast, of course, we all have the experience, I think, during the medical school, the college, to place a cast in a patient, and of course, to place a splint. When we place a cast, we must consider that it completely encloses and encircles limb. It has a specific position because it's a specific structure we treat on. A splint only partially encloses and encircles a limb. Okay? A cast is not attached by Velcro straps or bandages. On the other hand, a splint is attached by Velcro straps or bandages. We can remove this, the cast, we cannot remove. A cast always custom made. A splint not always custom made. A cast cannot be attached by an MT in the field, emergency medical technician. A splint can be attached by an MT in the field. We use this in order to move fast, to reduce a fracture just for not a long period of time, and then according to the situation, they could use a cast or exchange the splint. The cast has to be cut off by saw or blade to be removed. A splint can be removed by unstrapping or unbandaging. No saw is needed. A cast cannot be adjusted if swelling decreases or increases of the limb, right? A splint can be adjusted if swelling decreases or increases. A cast takes quite a long time to make. A splint takes a short time to make. So I think it's easy to see, to catch the difference by practicing. But here we have some examples. This is the cast. This is the splint. We have the experience in the emergency department that usually splints are not made in factory and we have to improvise. We have to create one using some material that is not for this purpose, but we have to give a solution. In that way, splints are easy to make, right? I always send jokes, and this one the most I like. Just for breaking the ice, don't worry about it. Are you sure this is the correct treatment for a broken leg? Of course not, we all know about it. Just check this. Talking about joints, of course, they are also known as articulations. They are the place of union between two or more bones. We all know about it. Anatomical landmarks, again, you have the common structure. with all the details we must remember. We must memorize the external muscles, synovial cavity, bursa, joint capsule with synovial lining, the tendon, the enthesis, well, details like that, okay? Check all of this is for homework. It's your job now. So take it in count. This classification of joints, again, is just for information. The fibrous joints, cartilaginous joints, and synovial joints. We have the meanings, and we have some examples to take it in count, to check, to practice, and to consider again. The fibrous joints, inflexible layers of dense connective tissue, hold the bones tightly together, right? For example, fontanellas, known as soft spots in newborns, right? And they change into sutures when you become an adult. Cartilaginous joints allow only slight movement, bones connected internally by cartilage. For example, ribs connected to the sternum and pelvic symphysis, right? The synovial joints allow a variety of motions, articulate, come together, right? Just for information, check this. And now we have the classification, of course, the 6 most common kinds of joints. So take it in count, self-studying, read all of this, catch as much vocabulary as you can. And during the workshop, we can fix or we can practice pronunciation and meanings, okay? The difference between tendon, ligament, and cartilage is, of course, known by everybody. But we must consider this just for catching vocabulary. Again, a slide for information, for catching the correct terms and how we must express these ideas. And now I see the pathology of the skeletal system. Usually during the systems, when we talk about them, I'm gonna show you some pathologies. And in that way, I'm gonna send charts like this. When I send you a list of pathologies, the most common ones, of course, there might be some of them absent, some details that I'm not taking in account because it's a lot of information. These charts are helping us to check how to write down about the pathology, but we don't have enough time to check all of this information, just a general view like in fractures, okay? So you could see, practice on this, read all of them. If there is a question about, I don't know, pronunciation, or maybe a typing mistake because I did it by myself, let me know tomorrow during the workshop, okay? And then we can correct this. For example, in pronunciation, we have this rheumatoid arthritis, or we have gouty arthritis. Another one, herniated disc, or maybe osteomalacia. Take it in count, practice on this. It's for you, okay? And now I have this chart, one of the most important in my opinion. As I was telling you at the beginning when we were talking about symptoms and signs, all the classes we are going to consider some abbreviations, the most common ones, according to each system. When we use abbreviations, of course, they have an objective: to save time while writing down and to get into communication with our colleagues during the medical history, the clinical report, the case report, the letter of referral, anything we need. In that way, these abbreviations, lots of them are the same in English and in Spanish. That's why it's easy to make. But some details, for example, I don't know, total hip arthroplasty, we have the HA. We all know, we see this procedure into context, we find this abbreviation, we know that we are talking about it. So we don't need to write down the complete the full term, the complete names of every word. It's not necessarily. It's easy to work with this while practice, okay? Fracture, well, fracture FX, as always. closed reduction, CR, bone density testing, BDT. So, you know, procedures, some details, very, very common ones. These are the most important, in my opinion, the ones that are found in books. Practice on them. And during our practices while writing down, we are going to use this. Of course, they go for homework and the final test, not all of them, okay? Let's get into muscles. Again, the overview, the major structures, the related combining forms, and the primary functions for reading at home. Muscles, related combining form, muscle, musculo, myo, myos, myoso. Then we have fascia, or fascio. We have tendons, teno, tendo, or tendino, right? With all of them, it's easier to prepare our medical term. It's easy to prepare to make this. And then we can catch the general meaning of this. The word parts, again, we have this prefix. When we see some word or some prefix and a hyphen, we know that it's a prefix, the same as in Spanish. Twice, double, or two to be. The suffix sale, hernia, tumor, swelling. Suffix, prefix, this, bad, difficult, or painful. Word root, fascia, fibrous band. Fibro, fibrous tissue, fiber. Suffix aya, abnormal condition, disease, plural of ayum. Again, grammar rule, right? The suffix iz, ik, pertaining to. Word root, kinds, kinesio, kineso, movement. Word root, my or mayo, muscle. Suffix pleasure, paralysis and stroke. Suffix rexis, rupture. Word root tax and taxo, coordination, order. Word root teno, tendo, tendino, tendon, stretch out, extend, strain. Tono, tone, stretching, tension. And the prefix tree, that is tree, right? So take it in account. Similar to Spanish, right? The structures of the muscular system, we all know from the macro to the micro structures. This is just for information, for reminding the anatomical and physiological structure and the function of every part, just for information, but check all of these details for catching the vocabulary, okay? We have these musculoskeletal anatomy tips, tendons, connect muscle to bone, and ligaments connect bone to bone, just for clarifying the idea. We have the types of muscle tissue, the skeletal muscle. We said it's attached to bones, make possible body motions. Voluntary muscles, we have conscious control over these muscles. We all know about it. And they are also known as straight muscles or straight or stripped. Take it in count synonyms. About the smooth muscle, they are located in the walls of the internal organs such as the digestive tract, blood vessels, and ducts leading from glands. They move and control the flow of fluids through these structures, right? Involuntary muscles, they are under control of the autonomic nervous system. And synonyms again, also known as unstraight muscles or visceral muscles. Okay, catch this vocabulary. And now we have the myocardial muscle, also known as myocardium or cardiac muscle. Form the muscular walls of the heart. Involuntary muscles, it is the constant contraction and relaxation to cause the heartbeat. In appearance, look like a straight skeletal muscle. in appearance, but function, of course, we know that it's different, just for making a reminding. About the contrasting muscle motion, we say, well, we talk about flexion and extension. Just check this for maybe refreshing these ideas, just for information, but take into account the contrasting motion, okay? We have some of them: pronation, supination, dorsiflexion, plantar flexion. We have abduction, adduction, circumduction, rotation. I'm sorry. Now we have homework again, the superficial muscles. The superficial anatomical landmarks are the most general ones, the most important ones for checking how they are written down and how we have to memorize them, to practice on them. Of course, going to homework and the final test, okay? Prepare on this, practice on this, and all of them are in English at this point. We have some medical specialties related to the muscular system. I consider this slide as very important because we have the chance to check that that's not only one doctor who checks this system specifically. For example, we have the exercise physiologist, the specialist who works under supervision of a physician to develop, implement, and coordinate exercise programs and administer medical tests to promote physical fitness. Interesting, right? Common: a neurologist, a physician who specializes in treating the causes of paralysis and similar muscular disorders in which there is a loss of function. The physiatrist and the sports medicine physician. Well, the physiatrist is a physician who specializes in physical medicine and rehabilitation, with the focus on restoring function. Rehabilitation is the restoration following disease, illness, or injury of ability to function in a normal or near normal manner, right? And the sports medicine physician, the one who specializes in treating sports-related injuries of the bones, joints, and muscles. Just take it in account as an extra information for catching some vocabulary. The pathologies of the muscular system, as I told you, this is the list I'm showing you. Maybe I lost some of them. Now you have some according to fibers, fascia, and tendons. For example, you have this list. Muscle disorders, you have all of this list. Muscle tone, you have these three ones. Muscle movement, this list again. Muscle function, this one. Sports injuries, the most common ones. Repetitive stress disorder, again, a list. For checking this, for practicing pronunciation, okay? And never give up. Great things take time. Of course, take time. This kind of job is not easy to start preparing and memorizing. It's a lot of information, I know. There are a lot of slides, but well, that's the purpose, to start practicing on this. In that order, give me 2 minutes while filling the pools, well, the attendance pool, to upload the slides into the Zoom chat to take attendance. And let me send you the pool. Okay, can you all watch the pool? Hello? Okay.
Not really, I can't.
Okay, send me a message in the chat, and at the end I'm gonna send it again. The ones who feel this, please tell me in a message. Don't, I did it, I feel it, something like that. Okay, so okay, that's the only moment I can say. I'm gonna share the slides during into the Zoom chat. If you are here, I cannot download it. I understand it now, but not tomorrow morning or later on. If you were not attending the class, I'm not going to send the slides. As I told you at the beginning, it's not correct. It's not fair. Okay. Okay, so Melissa, you couldn't watch this. Okay. I have 14 from 16. One is Melissa, and I need one more to check. Okay, Brenda, Belen. Perfect. Okay, Belen and Melissa, only you two, please fill this pool again. I'm gonna relaunch it. Okay, Melissa and Belen, just 2 people, please. Now,
For
can you watch?
me, it just appears that the votation is stars, but I try to put like click on it and I can't.
You cannot. Let me give you a solution. Get
Please.
into. Okay, try to leave the Zoom session now and get into again. We are going to share it again when you come back. It usually happens. Okay, Belen, the same. It's a good option to leave for a minute and then come back. Okay, about the slides, the rest of you people could download it. Perfect. Okay, Belen. Belen and Melissa, I'm relaunching again. Okay, try to fill this one now. Is that possible, Melissa and Belen? Yes, perfect.
Yes, thank you.
Yes, for me it's done.
¿Pueden enviar de nuevo las
I'm
diapositivas?
sorry. Belen, yes, I'm gonna do it. Don't worry about it, I understand.
Thank you.
Okay, all of you could download it, the slides. Is that possible to make it? Okay, I'm uploading it again, Belen, so take it, okay? Download it and let me know that you could download it and open it. Okay, perfect. The ones who fill the poll and download the slides can leave the session. That's great. That's all at this time. And tomorrow during the workshop, well, you know, we can solve doubts about anything you need from this presentation and the previous one. While finishing this class, I'm gonna upload into the WhatsApp group the role, because as I told you, the role is gonna change according to your attendance. If you don't attend, you're going to stay at the end of the list. And we are going to move it, okay? So that's all. And any question to my personal WhatsApp, not by the group, for not filling it with too much information, okay?
Okay, good night. Okay, thank you. Good night.
Good night. Have a great night. See you.
Thank you, teacher. Good night.
You're
Thank you,
welcome.
teacher.
Have a good night.
Bye, teacher.
Bye. Bye. See you tomorrow. Okay. Well, it's everything done. I think we can close this. We can finish this. So, Misael, Liz, I'm gonna close the Zoom session, okay?
Okay, teacher, bye. See you tomorrow.
Okay, see you tomorrow. Liz, yeah, give me a second, please.
Yeah.
Yesterday we couldn't talk. I sent a message, but well, there was no answer.
I can, sorry.
No, don't worry about it. I understand. It was too late.
Yeah.
Tomorrow, well, because of this rule of changing the schedule, I exchange your place at the end.
Yeah.
Let me show this to the group, and then if you want for tomorrow, I can send you a message 10 minutes earlier to your time for not losing again the workshop, okay?
Okay. Okay.
It could be easier for this time in order to help you to catch the difference in time, okay?
Yeah. Thank you.
Okay. So
Have a
see you
good
tomorrow.
night, teacher.
Have a
Bye.
good night. Bye, Giselle.
Thank you.
Okay.